Unit 4, Antipsychotic Medications. Module 4.1, Antipsychotics, Indications and Symptom Targets. Antipsychotic medications are used to manage psychotic symptoms and other severe mental health conditions. Nurses play a key role in recognizing symptom patterns and monitoring patient response to treatment. Antipsychotics work primarily by blocking dopamine receptors, helping to reduce symptoms caused by excessive dopamine activity in the brain. These medications do not cure mental illness, but they help manage symptoms and improve functioning. Antipsychotics are most commonly used to treat schizophrenia and other psychotic disorders. They are also used in bipolar disorder, severe depression with psychotic features, acute agitation, and sometimes for behavioral disturbances when safety is a concern. Antipsychotics are most effective in treating positive symptoms of psychosis. These include hallucinations, delusions, disorganized speech, and disorganized or aggressive behavior. Traditional first-generation antipsychotic agents only treat positive symptoms. Negative symptoms of psychotic disorders include flat affect, social withdrawal, lack of motivation, and reduced speech, while cognitive symptoms may involve poor attention, impaired memory, and impaired executive functioning. Second-generation atypical antipsychotics may provide modest improvement in these symptom domains, which is why they are sometimes used as adjunctive therapy with antidepressants when patients have a partial response to antidepressant treatment alone. As mentioned, antipsychotic medications are divided into first generation, also called traditional, and second generation, also called atypical antipsychotics. While both treat psychosis, they differ in receptor activity, side effect profiles, and symptom target. First-generation antipsychotics primarily block dopamine D2 receptors and are most effective in treating positive symptoms of psychosis, such as hallucinations, delusions, and severe agitation. Examples include haloperidol, Haldol, chlorpromazine, thorazine, fluphenazine, prolixin, perfenazine, trilafon, trefluoperazine, stelazine, and thioridazine, Mellaril. These medications are associated with a higher risk of extrapyramidal symptoms, especially at higher doses. EPS is covered in detail in Module 4.2. Strong dopamine blockade, higher EPS risk. Second-generation antipsychotics block dopamine receptors but also affect serotonin receptors, which lowers the risk of movement-related side effects and improves treatment of negative symptoms, such as flat affect, social withdrawal, and low motivation. Examples include risperidone, Risperdal, paliperidone, Invega, olanzapine, Zyprexa, quetiapine, Seroquel, ziprasidone, Geodon, aripiprazole, Abilify, brexpiprazole, Rexulti, clozapine, Clozaril, lurasidone, Latuda, cariprazine, Vraylar, asenapine, Safaris, iloperidone, Fanapt, lumateperone, Caplita, and olanzapine, Samidorphan, Lybalvi. The distinction between typical and atypical antipsychotics is based on receptor profile, risk of extrapyramidal symptoms, and symptom coverage. Atypical antipsychotics have a lower incidence of EPS, are more effective for negative symptoms, and include clozapine, which is uniquely effective for treatment-resistant schizophrenia. Antipsychotic medications can cause a range of side effects, including somnolence, weight gain, photosensitivity, and orthostatic hypotension. Metabolic syndrome is particularly common with many second-generation, atypical antipsychotics, and nurses should closely monitor for weight gain, increased waist circumference, elevated blood pressure, hyperglycemia, and dyslipidemia, including increased triglycerides and decreased HDL cholesterol. Other potential adverse effects include anticholinergic symptoms, QT interval prolongation, cardiovascular complications, and hyperprolactinemia, which may present as galactorrhea, sexual dysfunction, or menstrual irregularities. Some antipsychotics may cause skin hyperpigmentation, and clozapine is commonly associated with sialorrhea or excessive salivation, which requires patient education and monitoring. Many psychotropic medications can lower the seizure threshold, increasing seizure risk, especially in patients with a history of seizures, brain injury, substance use, or metabolic imbalance. Among antipsychotics, clozapine, Clozaril, poses the highest seizure risk. Additional medications associated with increased risk include chlorpromazine, thorazine, olanzapine, Zyprexa, and lurasidone, Latuda. Other antipsychotics, such as fluphenazine, prolixin, thiothixine, Navain, risperidone, Risperdal, and quetiapine, Seroquel, are less likely to significantly lower the seizure threshold. Certain antidepressants also increase seizure risk, including bupropion, Wellbutrin, high-dose paroxetine, Paxil, and tricyclic antidepressants like amitriptyline, Elavil, and clomipramine, Anafranil. Some antipsychotic medications can cause anticholinergic side effects due to their action on muscarinic receptors. Nurses must recognize these effects early and provide appropriate patient education. Common anticholinergic symptoms include dry mouth, dry eyes or blurred vision, constipation, and urinary hesitancy or urinary retention. In severe cases, anticholinergic toxicity may occur. A helpful memory aid is red as a beet, dry as a bone, blind as a bat, mad as a hatter, hot as a hare, and full as a flask. These phrases describe flushed skin, dry mucous membranes, blurred vision, confusion or delirium, hyperthermia, and urinary retention. Nursing action: monitor bowel and bladder function, encourage hydration, and report signs of toxicity promptly. All antipsychotic medications carry a black box warning for use in older adults with dementia-related psychosis due to an increased risk of death, primarily from cardiovascular events and infections. Nurses must carefully monitor older adults and ensure antipsychotics are used only when benefits outweigh risks. NCLEX memory hooks. Typical: strong dopamine blockade, higher EPS. Atypical: serotonin, plus dopamine, better for negative symptoms. Clozapine, treatment-resistant. Antipsychotics, plus dementia, black box warning.